bienvenue dans Topik Conversation pour aujourd'hui bon matin. Et pareil, mon dit aujourd'hui bon matin, nous pour cause un petit coup dans nous les corps, bien sûr, il y a bon mot qui de temps en temps, nous avons dit, nous t'en dit, il gagne un slip disc, nous t'en dit, il gagne un spine, problème les dos, problème ici, problème là-bas. Mais aujourd'hui bon matin, nous apporte ça. Qui nous pourra adresser aujourd'hui dans Topik Conversation et justement nous all the way from Victoria Health Clinic pour encore une fois nous joindre un autre docteur cette fois-ci quand nous pourrons adresser ça bonne cisé bien sûr nous pour adresser à des 4 cisés aujourd'hui bon matin nous pour cause slip disc bien sûr qui end après nous pour dire spine surgery bien sûr nous pour cause arthritis par exemple dit plus bonnet ben l'inflammation de besoin capable dans cou capable dans genou tout ça là la goutte un petit peu et dernièrement après nous pour cause le knee replacement ben l'opération qui nous fait avec nous genou aujourd'hui bon matin c'est ça que nous pour aborder c'est pas hésiter pour causer avec nous malgré nos interviews hier qui pour en anglais ou connaît yo fait type en créole type en anglais envoyez-nous et nous au moins qui possible n'a capable faire sa translation pour aujourd'hui bon matin all the way from Delhi docteur qui nous joint nous aujourd'hui DR.HIMANSHU.GUPTA. Good morning.
Morning, ma'am.
How are you?
I'm good, feeling good.
Feeling good?
Yes, absolutely.
Absolutely. Can you introduce yourself to sessions?
Yes, ma'am. So my name is Dr. Himanshu.GUPTA. I'm an orthopedic spine surgeon by training, and I've done a fellowship in interventional spine and pain, followed by a fellowship in knee replacement and joint surgeries. So I've done about 16 years of my experience post my graduation, post-graduation, and I've done more than 10,000 spine interventions and close to about 6,500 knee surgeries.
Oh.
So which includes arthroscopy for sports injuries, for arthritis, and knee replacements, mini-invasive knee replacements, partial knee replacements, everything. So here I am in Seychelles, in your studio, finding myself answering your questions.
And how do you find Seychelles?
Oh, Seychelles is a beautiful country.
Is it your first time here or no?
Yeah. So it's a beautiful country, very well-mannered people, good beaches, nice food. And
nice food.
Yeah, and on top of all, I mean, you get to do a lot of other activities. We did a lot of ice bath and sauna baths and deep massages, everything. So it was good.
You've been very curious.
Yeah.
In Seychelles. Et par la nous dit, et merci Dr. Gupta, et pour la dans Victoria Health Clinic, bien sûr, qui peut donner une consultation. Alors, ça pas hésiter ou qui peut gagner une douleur pareil, nous nommer, si on n'a aucun petit doute, alors pas hésiter pour aller côté Victoria Health Clinic pour capable gagner contact avec Dr. Gupta, bien sûr, et là, il est capable de nous une guidance, il a consulté ou pour voir qui bon problème et là s'il y a quelque chose pour approfondir bien sûr on est capable de faire premièrement aujourd'hui bon matin nous pour cause nous tirani le slip disc. The first we're going to talk about today is the slip disc.
So normally patients, about 85 to 90% people in their lifetime will get a back pain.
Yes.
And that's something not these are all studies that I'm talking about. And we tend to get these patients who present with simple back pain. Most of the back pains that we also have gets better with rest, doing a little bit of hot fermentation and taking some rest, some pain medicines, and we improve. The talk is about the pain which is increasing in intensity, the pain which is always there even in sitting, standing, walking. As the time passes by, it is increasing in its severity and it starts radiating to the legs. When it starts radiating to the leg, that's when we call in a common language a sciatic. This sciatic pain is usually caused by a compression of a nerve in the spine. So I just brought a model so that we can actually explain it to our people here.
Justement, docteur, justement, il amène un modèle aujourd'hui, bon matin, avec les expliquer en même temps pour montrer un petit peu de démonstration pour expliquer qui est sa bonne douleur et what to do. Voilà, docteur, qui nous explique. Alors, restez attentifs et regarde bien la bon matin. Yes, docteur.
So in between these bones of the spine, we have these elastic structures which are called as discs, these. And these discs are the ones which actually give us the flexibility. They give us the strength and they keep our spine straight. Now, because of the bad postures or sometimes you have a fall, you get down, you fell down, you get a disc which is like a jelly which comes out causing a pressure on these nerves. This is the nerve which gets pressed causing all the way down, pain in the leg. That's a sciatic causing pain, causing numbness, tingling, paresthesias, what you call in a common language here is agogi. So that's what it calls. So what we do in these cases is, normally in a grade 1 disc, when it is a small bulge, you just treat it with rest, physiotherapy. When it's a grade 2 disc, you can actually treat it with just a simple laser inside the disc with needle. When it's a grade 3 disc, when it's a little bigger disc which has come out, we are able to do a minimally invasive spine work with endoscope. We are able to put in a small camera from the side of the spine, go into this disc and remove that fragment which is causing the pressure and not the full disc. The good part about endoscopy is that you are able to mobilize the patient on the same day. He can go home in about a day and going back to work in 1 week, compared to the conventional spine surgeries where it usually takes about a month. Only in cases where there is a large disc or there is a little bit of a instability in the spine, you need to do a open surgery and put some implants to fix it. But that's less than 10 to 15% of the normal patients that we see for spine disc. For spine problems, if you have 100 patients, only 10 would require open surgical treatment. Having said that, the only way to diagnose this condition is by doing an MRI. An MRI is an advanced technique which is called as a magnetic resonance imaging, and that's supposed to show us the position of the discs, the grade of the disc I am talking about, the nerve compression, and the amount of swelling on the spinal cord. Now, unfortunately, right now in Seychelles, when I was there this visit, we saw close to about 30-35 patients having these problems, but only 1 or 2 of them had MRIs. So it is something which is infrastructurally missing in the country. There is only one MRI currently at the hospital, and they are also overloaded with the amount of work which is to be done by the MRI machine and the radiologists, the radiographers, everybody is overloaded. So the patients, even if I advise them for MRI, will get a long waiting time. Till that time, most of the patients keep suffering with their pain or their numbness and tingling, and these things keep on increasing.
What happened while waiting with the patient?
They have to just rest in bed, take leave from work, not able to live a normal life. In most cases, it keeps on increasing, the pain. And at the ultimate time, then they have to be admitted in the emergency. There they do the emergency, they do the MRI, and then they possibly proceed ahead with the surgery. So cases wherein you can actually catch them at an early stage by doing an MRI at the right stage of the disease, then you can actually treat them going forwards with a minimal treatment compared to a surgery going forwards in a waiting period of 3 months, 4 months. So in the same endeavor, we have actually come out to look at possibly positioning a MRI at Victoria Health Clinic, and we are in discussion with the ministry, and they were kind enough to give us the time to meet, and we will be submitting them the proposal and going ahead with the MRI placement there. Once that is achieved there, it is going to be helpful for all the Seychelles population, as well as for our conditions and our specialists who will be visiting Victoria Health Clinic on a regular basis to treat these advanced conditions at a young stage. You can actually diagnose and treat them before they graduate on to a bigger condition or a bigger problem. I mean, we have seen 30-year-old people having slip disc, having back pain, sciatic pain.
30-year-old?
30-year-old. No, because of the posture. You're sitting long hours. You're sitting on the laptops. You're sitting on the beds and working.
And we often do that with Seychelles people. We tend to sit long hours, more than 8 hours. We just sit.
So that causes a lot of pressure on the spine, definitely. So you need to do regular movements and prevention techniques. But yes, there are 30-year-old people suffering from sciatic pain, 1.5 years. And then now I advised him MRI. He was having an MRI and he has a disc problem. He will need a treatment. So we will do his treatment in terms of a minimally invasive treatment here itself in Seychelles, rather than for him to travel all the way to any other country. So that's what we also want to bring in, what we call as a reverse medical tourism. Most patients actually going out of Seychelles, and we lose out on the economy and the money. So whatever can be treated in the country with the best of services, we are going to bring them here.
We're going to bring that. Bonne nouvelle, Cécile, c'est que tout ça que nous devons être capables de faire ici, c'est sans qu'il y ait besoin de déplacer pour aller à l'étranger. Là, qu'il y a tout ça, quelque chose ici, bonne nouvelle, c'est qu'il est capable de faire ici sans besoin, pas juste même déplacer, dépenser à l'étranger. Alors, pourquoi pas, ou faire sa petite visite ici, côté Victoria Health Clinic, et là, tout à Paris, docteur Indi, collaboration avec le ministère de la Santé, et bien, c'est de bring in more quelque chose qui nous, nous paye besoin, ça qui nous besoin de dépenser, ça qui nous besoin à dépenser. Bonne specialized docteur qui arrive ici, c'est justement pour nous capables de gagner sans consultation. Et là, ça semaine, docteur Gupta est là, Victoria Health Clinic. Alors, si vous pouvez ressentir bonne douleur, par le docteur il montrer le modèle, c'est un petit coup côté Victoria Health Clinic avant et trop tard. If the worst come to the worst, doctor? If the worst come to the worst.
If it comes to the worst, then we do a surgical intervention. And these days, when you're doing surgical intervention, you do not do a big surgery, you do it with microscopic.
Microscopic.
Yes, so you use a microscope, an operating microscope, which we have at Victoria. And we are able to decompress the nerve root with a minimal of intervention and a minimal of surgical scar and make the patient get back to activity within 2 to 3 days.
3 days?
Yes, but the whole thing, the whole point about it is that slip disc is not only in the lumbar, it can have in the cervical, in the thoracic, any place. So we have to be very mindful of our postures. We have to be very mindful of how we sit, how our neck posture is, how long are we sitting at a stretch, and how much are we exercising on a daily basis. That's very important.
We need to stretch, people. We need to stretch. How long are we sitting? Ça est très, très important. Pas besoin assis plus que 8 ans sans qu'il vous leve, sans qu'il vous fait un petit ready par nous dit, stretch un petit guin par le docteur dit, we need to do that. Nous êtes debout au moins 3-4 fois de 8 ans qui vous pousse à cause pour un dommage. Doctor, we have a question regarding slip disc.
Yes.
Good morning, Carol. Good morning, doctor. Ask doctor if he can do spine replacement and stem cell treatment.
There is nothing, unfortunately, as spine replacement. But yes, when you have a problem because the bones cannot be replaced. It is the problem in between the bones which always causes you the problem or the delay, the pain. So what we usually do for these conditions is we treat the actual problem. So once we see the MRI, we see it is the disc or the ligaments or the joints which have become problematic or pathological, causing pressure on the nerves. And that can be treated very easily. You do not need to consider a spine replacement. There is nothing like a spine replacement surgery. And stem cells, it is considered to be still in the initial stages. It can be possible to done for patients who have had some sort of a spinal cord injury, having paraplegia or paralysis in the legs and all that, but it is still in the initial stages. It is not proven yet as to how much recovery it will give. So if the spinal cord is completely broken, that's like the God's electrical wire. You cannot fix it. You cannot even replace it or fix it. And even in the best of places, even in Mayo clinics in US, you are not able to do it.
There's nothing you can do.
You cannot do for that. But it has to be done immediately at the time of injury. If within first 24 to 48 hours, maximum 72, you are able to decompress the spinal cord and the pressure or the blood clot which has formed on the spinal cord, you are able to open it, that should be good enough in most cases to give us the power. But if the spinal cord is completely cut, it's God's creation. You cannot actually replace it or fix it up. So, but yes, in these cases, stem cells are being researched. Some patients have got some relief, but not at a stage wherein it is, we can call it a scientific stage right now. It is not yet proven.
Voilà la réponse pour aux questions qui ou demandait. Docteur donne l'explication, and the person says thank you for this. And now we move on to our next one, which is arthritis.
Yes. So, by definition, arthritis is arthros-itis. Arthros means joints, itis means inflammation.
Inflammation.
So, any inflammation in the joints, it could be shoulder, it could be knee, it could be ankle, it could be hip, it's called arthritis. So, that's a general term that we use.
So, between different part of the body.
Yes. So, arthritis, when it is involving multiple joints, it's more of our own body, which is like an allergic reaction causing an autoimmune condition, that is a rheumatoid arthritis or some sort of autoimmune arthritis. So, right now for that there are medications, there are proper preventions and treatments which can be followed to make it better. As far as the different arthritis, we are talking about knee today. In terms of knee, we get a lot of patients who in the early ages, even in your age, young age, they tend to
Yes.
have a lot of knee pain. That again is bad postures. So when you're sitting for too long, when you are your work involves standing, too much of stair climbing and all that, that causes a lot of these knee pains, knee inflammations.
That can be a factor as well?
That can be treated just with simple stretching exercises, cycling, swimming, all that. It just makes the quadriceps and the hamstring, the two muscles around the knee, balanced and makes it better. As far as the arthritis of old age, or we call it degenerative arthritis, that's something like people gray hair, people actually lose their teeth. Similarly, it's a degeneration process. So because of use, wear and tear, the joints get used up. When these joints are getting used up, that's the stage wherein you get to arthritis. That's something which can be diagnosed on the X-ray. MRI is required if there is an acute increase in the pain in an arthritis patient. Based on the X-ray, you do a staging. So, if it's a grade 1, grade 2, normally medications, exercises are good enough. If it's a grade 3, we do a platelet-rich plasma, a PRP injection inside the knee for the inflammation, for the cartilage balancing. If it's a stage 4, we are sometimes able to, if the meniscus is stuck, we are able to just balance it out with arthroscopy and shave off the extra inflammation and the synovium which is inflamed. But it's a stage 5, there is too much of curve in the leg, they are not straight, they are curved. In those cases, we do a knee replacement surgery, wherein you do not replace the full joint, but it's basically resurfacing. So the cartilage surfaces which are rubbing with each other, you balance them out, shave them, put a new implant, and that forms a new joint. And this new joint is what is a knee replaced joint. The 2-3 things that are important in this is, if you are pretty systematic in your surgical technique, the patient gets a 25-30 year pain-free life.
Wow.
Yes, and these implants that we have available these days, they have a good mobility quotient, so the patient can start standing from first day, 24 hours, and they are out of the clinic in 3 days to 4 days. And the walking is something that they can start going out of the house and everything in about a week's time. The good part is we are using a little bit of your computers in this, wherein the X-ray of the patient guides our computer program and the software to decide the amount of bone to be excised, and we do it with computer navigation. And that's how you're able to minimize the bone loss, and you're able to give the best results with the best of implants. And that's something which we are very proud to announce that it's available in Seychelles now. We are able to do it in Seychelles, and we would be able to help out patients who are having arthritis, advanced degeneration, and who are willing to come over to us. We will be definitely helpful in terms of giving them a good life, a pain-free and a straight life, rather than the limp, the pain, inflammation, taking pain medicines on a regular basis.
Pour la journée, quand nous pouvons prendre pilule, nous pouvons prendre médicaments, nous pouvons masser, nous pouvons boiter, nous pouvons masser dans une bonne douleur. But the good news is que nous sommes capables de faire cette opération ici. C'est le présent, par le Dr. Gupta peut expliquer là qui là, au papa, ou pour un petit moment, dans le temps, sauver un petit gain, sauter un petit coup. Côte Victoria Health Clinic, on voit Dr. Gupta avec son équipe, bien sûr, vous êtes capable bien pour vous être capable de consulter ou d'abord voir qui est le problème et là vous allez guetter qui y en a pour faire à cause là vous sentez la douleur, s'il vous plaît. It's best that you report. Better safe than sorry. Tout le monde dit ça. It's best that you report or otherwise then I will n'a pas rien que capable faire. Alors ces petites douleurs quand nous parler nous confuser nous dire dans de l'eau. Sometimes we tend to say there is water. Does it relate to gouts and everything like that?
So yes, there is inflammation. That's again, as I said, the internal cause or the body's cause of having an inflammation or pain in the knee. The causes could be a simple injury, it could be gout. Yes, pretty common in this part of the world because of the increased habits of having non-vegetarian food tends to increase the protein content and thus increasing the gout component. But once that is there, if it is leading to inflammation, you can actually give medication, it sort of settles down, dietary modification settles down. But if it doesn't, then sometimes you have to pull out the fluid with needle, or for the gout crystal, sometimes you have to arthroscopically remove it. And that can happen in the knee, in the elbow, any of these,
Any joint.
the toe of the foot, that's the most common joint. that requires a little bit of a dietary modification and medications in most cases. 95% cases you don't need to do any surgeries. Just have a healthy habit and
Healthy
a good,
lifestyle.
yes,
Healthy
exercises.
Exercises, doctor say exercises, so pas pour besoin à le faire sometimes, hein? Pas besoin à le faire aucun l'opération. Si vous pouvez vivre un healthy lifestyle, si vous avez une bonne santé, de temps en temps vous faites un petit check-up, pas pour à faire l'opération, pour n'a pas aucun sens pour faire l'opération si vous pouvez faire ça bonne question. Par contre, si vous ne prend cas avec le corps, then yes, you have to go pour faire une surgery qui parfois qui partie nécessaire. More questions coming in, doctor.
Yes.
Bonjour, Carol. These people with spondylosis, if I'm correct, yes?
Yes,
Neck
spondylosis.
pain all the time. So what medication they need to prevent, how to control it?
So spondylosis is something which is an arthritis of the spine. So when your joints in the neck or the lower back and the mid back, they get used up, that's called spondylosis. This best medicine is good posture and exercise, let me tell you. When you get pain, you can have any pain medicine, any paracetamol or something to decrease the pain and inflammation, do a little bit of physiotherapy, which also helps in these conditions. It's like a knee joint which gets damaged, so you have to avoid those activities which is causing increased pain, like sitting cross-legged or using stairs. Similarly, for the neck, when you have
Sitting cross-legged.
no, this is not. This is cross-legged.
Okay, I'm sitting
When you
cross-legged.
have a knee cervical spondylosis, you have to make sure that you do not use too much of your mobile phone, your iPads, because your neck posture is like this, and when the neck is bent for too long,
Literally
causes
concentrating on it,
yes,
yes.
it causes a lot of pressure on the neck. So you have to work on your systems. You have to connect your probably a laptop to a desktop monitor so that your neck is up, and doing regular exercises for the upper back and the shoulder area to make it strong. That area should be strong enough so the weight which gets transferred onto the neck muscles is less, and that will decrease your spondylosis component. But if yes, it is too much advanced, sometimes you have to do a small surgery and fix it.
You have to do sometimes a small surgery to fix it. This is your answer to your question. What about massage?
Massage, as I said, like physiotherapy or massage, it decreases the soreness and the inflammation in the muscle. But if it is something to do with the joints, it will not improve.
It will not improve.
Sometimes it increases post-massage. So if it is an arthritis pain, we usually try and avoid massage in the joint, but only in the muscles.
We recommend that you report. It's best that you report to the specialized orthopedic doctor. Now that Dr. Gupta is here at the Victoria Health Clinic, so why not? Just visit Dr. Gupta. Morning, do they cater for psoriatic arthritis as well?
Psoriatic arthritis.
Psoriatic
Arthritis is again an autoimmune condition. It is something which, along with the skin, like a reaction, the internal body's reaction, that's a psoriasis. When it involves the joints, it's called psoriatic arthritis. Again, 95 to 96% of these patients tend to improve with medications and proper precautions and application of some creams and hot fermentation. Only in about 3 to 4% cases where the joints have got damaged on a pretty advanced stage, do you need to replace the joints, or in an early stage sometimes do infiltration inside the joints for PRP again. That's something which is helpful.
There's a question answer to your question that you have been asking. I want to ask doctor about the treatment. Do they change with the age at the age or stage?
Yes, again. So, I mean, we see patients who come to us at the age of 50 with a severe arthritis, and they say, doctor, but I think this is not my age to get arthritis. So that is a question that you need to ask the God.
Is it confusing at times, age and stage?
It is, because age is something which will not decide the stage of the disease. If you have taken care of your knees at the early stage, or if you have a family history of joint pains and arthritis, you will have it at an early stage. If your mother has had it at 60, you can have it at 50. It's like this. So early age does not mean an early stage. So it can be an advanced stage of arthritis needing a replacement at even at 50, 52, and even at 75, years of age, sometimes the patients have a early stage, like a grade 1 or a grade 2, and you can treat them with medications. Because you have patients who come in the OPD at 70 years and they feel that if they go to the doctor, they would be told a surgery and they're scared of going to the doctor. So don't be scared. You can be suffering from a very early stage of
Some
arthritis
people
and can be
very
treated.
scared to go to the doctor.
Yes. And we are not those ones to be scaring them. So we are the ones who giving them the right advice according to the problem that they are suffering from.
I think they're not scared of, some are very scared to go to the doctor, but we know some are very scared
Of the surgery.
of the result that they will come up with.
Yes, true.
They don't want to hear the result. That's it.
But if you are having a condition which is impairing your life and your social life, then you need to meet a doctor and find out the solution. And there are solutions for each and everything in this current world. When the world has moved so fast and so ahead, we can find it. It's not a problem. You don't need to suffer with your difficulties.
C'est ça, si nous pouvons souffrir, malgré nous pères, par nous dit pas le côté docteur, parfois nous dit, mon papa, pas le docteur, c'est moi pas connaître qui docteur pour dire mon qui résultat, mais seulement, là, moi, je vous dis, bon matin, challenge le corps, si ça la permet de côté, à voir un docteur avant il trop tard, s'il vous plaît, it's better safe than sorry. When it's too late, it is too late. So, why not, là, comme docteur Gupta, il a côté Victoria Health Clinic, saute un petit coup, côté Victoria Health Clinic, dit au problème, tal, pareil, nous dit, et là, docteur, avec son équipe, il a été, what's the best he can do to help you, doctor, spine surgery? Let's talk about spine surgery.
Okay. So, there are different types of spine surgery as we discussed. So, what we will talk about is three things. First is interventional spine, wherein we do minimal interventions with needles, with lasers and stuff to improve the circulation on the nerve or decrease the size of the disc which is bulging, or in some cases even the joints of the spine which are getting arthritic, we treat them with laser and the pain is gone forever. When the size of the disc is a little bigger or the jelly has come out to a significant amount, we are able to remove that again with an endoscope or a camera, which is a very small device, and the patient is awake while we are doing it, and they can also see the whole thing on the screen. Yes, because we are also doing on the screen. It's an endoscope which is connected to the camera and everything, and we are able to see everything on the screen, treat it accordingly. It is when it's the advanced stage where too much of damage in the spine or the bones have slipped from each other. In those cases, do we need to do a spine surgery? And by itself, conventional spine surgery is currently on its way out across the world. Most of them are minimally invasive surgeries where you do a small cuts with the help of a microscope. You are able to see the things very well. So you do not damage the spinal cord, you do not touch the nerves, and that's how you are able to achieve a good result. Most cases are able to get back to even work and activities and driving within a month of spine surgery. So that's the good part about it. But again, they should report at an early stage to avoid a spine surgery.
I say better safe than sorry. Huh? When do you consider it's going to be a spinal surgery?
So the red flag signs that we look for before intervening are a pain in the back going into the legs or leg, not improving, causing too much of numbness, too much of burning, even having some amount of problems with urine or motions, not able to control that, not even able to stand for a few minutes or able to walk 50 to 100 meters because of the pain and the numbness. That is the stage where we know that the compression on the nerve is significant enough for it to be decompressed.
Voilà un petit peu, c'est seulement pour demander au docteur quand il est capable de considérer qu'il a ou pour besoin faire bien sûr l'opération, bien sûr le docteur peut expliquer. Alors si vous pouvez voir sa bonne symptômes avec ou les corps, moment quoi is best. You report, parfois nous dit nous paris, pas paris, ça qui fait numbness in your body qui peut faire nous quoi pour dire nous peut faire un petit peu paris. Non, il pas paris, il fait bon quelque chose dans le corps qui peut empêcher masse. Sortir là par la boutique ou sortir là par Z, nous disons pas dans l'auto quand vous êtes capable de masser, quand vous êtes capable de faire quelque chose, vous pouvez sentir le corps pas permettre les sous masser alors it's the best that you report to bien sûr pour voir bon docteur, la docteur Gupta il a bien sûr côté Victoria Health Clinic diagnosis of knee pains.
Diagnosis of knee pains, as I said earlier, most cases along with the clinical examination with the doctor, you need either an X-ray and when you're not able to diagnose with the X-ray, I suppose in most cases the X-ray shows it's normal, the pain is too much. We had 2 patients this time. The pain was too much and the X-ray was normal. They have been to different clinics as well, and they were not being treated. They were given infiltrations, not improved, and we advise them for MRIs. Again, unfortunately, we don't have an MRI right now wherein we can diagnose it fast. It takes a little longer time. So possibly when I see them next time, in about a month's time, we will be able to see them with the MRI. But a gold standard test would be a MRI along with some basic blood tests to rule out arthritis, and in some cases only X-ray and blood test. But the gold standard is the MRI again, and that's something which is lacking right now in the country.
Voilà, c'est la bonne explication qui nous peut gagner là aujourd'hui matin. Si vous remarquez aucun sa bonne symptôme ou senti ou l'école abnormal, these are red flags, people. You need to report to the doctor, bien sûr, un petit peu partout. Et là, justement, nous pouvons causer comme un docteur, nous, il arrive de pays, nous aussi, nous, bonjour Cécile, nous pas hésiter nous aussi, nous redire, juste pour donner plus l'explication, et si vous pouvez sentir, waouh, sa position, pareil, docteur, peut expliquer, pourquoi pas, ou saute côté Victoria Health Clinic, demander pour voir docteur, l'équipe qui là, va assister ou, et comme ça, vous êtes capable de get what's the best, they can help. Some people are asking about pricing.
Pricing for?
For, let me see. Pricing for arthritis.
So that's a very general question. That's like saying what is the pricing for groceries. I mean, it depends on what condition you are having. If you are having advanced arthritis and you're looking at a knee replacement surgery, in this country we would be able to do the computer navigation and everything all within about 110,000. So that's something which is there. In terms of arthroscopy, it's much lesser.
Much less.
And again, the stage and the age of the disease actually tells us what is the actual pricing. So it's going to be very, very variable because there are multiple conditions.
Can vary,
it can vary
on what
or what
discover.
condition, how much is the deformity, what is the implant being used, and is it full knee replacement, partial knee replacement, computer navigation, no. So all these factors actually decide the pricing. It can be, it's a very varied range. So I cannot give you a particular pricing.
Nous pas qu'à donner un particular price par le docteur. It can vary à cause que faut ou peut aller pour dire ou dans Espagne il y a un problème et avec le docteur ou aux Zéno aussi il y a des problèmes. So pas capable donner mais seulement il donne à peu près estimation. It can vary. So juste pour arrêter les temps arrive là-bas ou capable la présent capable connaître à peu près quantité ou pour dépenser alors it can vary mais seulement pas en peso. On peut descendre pour l'opinion côté un spécialiste qui est spécialisé dans sa bonne sujet qui nous peut adresser aujourd'hui bon matin. This text is in Creole, doctor. Let me see if I can translate this one. Bonjour, docteur. Carole, docteur. I have done a surgery spine surgery in 2008, and the doctor tell me that there will no cure, no treatment because the disc has been gone.
So it was done in 2008.
2008.
When the disc was gone.
The doctor says there's nothing, even if they have done the surgery.
So I'll say if they've done a surgery and they've removed a part of the bone and this disc is completely gone, there is still multiple option wherein we put screw and in between the bones we put in a spacer which acts as an artificial disc, and that spacer builds up the space. So there are multiple treatments which are available. Again, we need to see the patient. It's going to be a case-by-case basis.
Can you come to Dr. Gupta? Can you come to Dr. Gupta at Victoria Health Clinic? Maybe he can help.
Yeah,
please.
I can see it and find out what is the way to treat her.
Yes. Why don't you come now, doctor? You are here until when?
Unfortunately, I'll be leaving tonight.
Ha! Comment fait fini?
Well, come again. I'll be again here.
Yeah. Descend à Victoria Health Clinic aujourd'hui là. Elle voit Dr. Gupta depuis 2008. N'a pas aucun traitement, n'a pas aucun cure. Un petit peu red flags, pareil nous dit. So, docteur va checker un petit gain. Alors, ça descend un petit coup. Do you do MRI, doctor, at the clinic?
We are going to very soon do the MRI at the clinic. We are in the stage of commissioning and installation, so it will take a couple of months, but we will very soon bring the new year with a good news for Seychelles.
This is good news. So keep fingers crossed, be patient. They are coming. And the last question, cervical spondylosis, doctor.
We just did it.
What does they did?
cervical spondylosis is the joints of the neck which are getting used up. And they get damaged because of the bad postures. We correct them with exercises and some interventions.
Mais justement, par nous peut causer aujourd'hui bon matin, nous adresse 4, au moins nous adresse 4 bien sûr qui concernent slip disc, arthritis, knee replacement surgery et aussi nous cause spine surgery qui nous cause là que docteur Gupta écoute Victoria Health Clinic ou capable aller là aujourd'hui à cause docteur Pierre et tantôt pas trop ta cassé pas trop plutôt déplacer plutôt mon cas dit là bon matin al voir docteur bon pas connaître si pour tourner mais seulement là il tient bien ou peut voir lui et docteur merci nous pour terminer aujourd'hui avec une vidéo qui docteur il a mené pour nous montrer les autres pour autres capables de bien comprendre tout ça qu'il expliqué aujourd'hui bon matin pour capable de bien comprendre aussi à travers sa petite vidéo pas oublier à côté Victoria Health Clinic qui bien sûr il y a l'autre remède pour tout nous bon problème de temps en temps nous gagne visiting specialist bien sûr nous aussi le bonjour Cécile nous fait nous mieux pour nous emmener autres le bonjour Cécile pour gagner plus détails et l'information comme ça il y a plus bien nous qui ça que problème qui vous peut voir avec les corps du message il relie avec le docteur il dit alors comme ça on est capable de rapporter docteur it has been a pleasure for this morning absolute pleasure.
Thank you,
so sad you're leaving tonight.
Yes.
But come again.
Yes, I will be here. And through you, Carol, I would like to sort of send across a message that having seen the patients here, having met different people in the last 1 week since I was here, I have realized one thing, that there is a need for more healthcare specialists in the country.
Really?
And with Victoria Health Clinic, we will be looking at bringing in affordable, specialized, ethical healthcare into the country for all. And that's what our motto is going to be. And we would be bringing in more specialists with the best of trainings to help the social population take care of their illnesses, because health at the end of the day is the wealth. And most people in the country, around the world, they have started investing heavily on their own health. And if you are not healthy, how will you contribute to your own, I mean, your job, your profession, your society,
family,
your country, everything.
Yes, and everything.
So that's the basic building unit of your, I mean, the patients. These days people are getting too much depressed and stuff. So that's one reason, because they are not healthy enough and they're not ready to talk it out with doctors or even with their family members. They keep suffering alone.
Yes.
And here, if they want to take treatment, sometimes because of the late delay in diagnostics in the MRI and the CTs and everything, they are not able to be diagnosed at time, and then again they suffer in pain. So we will be looking at changing the way healthcare is perceived here and bringing it the modern look with the affordable, ethical healthcare, as we say, for all. Thank you very much, ma'am, for having me.
Thank you so much, Doctor. It was an absolute pleasure. Parler Docteur
Same here.
Indy, docteur à travers Victoria Health Clinic, vous pouvez get la possibilité pour mener plus de partners avec les autres spécialistes en dehors, à l'étranger, pour mener les autres ici, Cécile, comme ça, nous pouvons la réponse pour toutes nos bonnes questions qui nous peuvent gagner adresser. Parfois, nous ne pas connaître. On a la réponse pour nous douleurs, pour nous quelque chose qui nous gagne avec nous les corps. Mais voilà, que vous pouvez partners avec les autres spécialistes à l'étranger que vous pouvez mener. Alors, de temps en temps, quand nous gagnons l'information, nous aussi, nous avons fait les autres connaître. Sinon, pareil, la docteur nous aujourd'hui, de temps en temps, quand nous gagnons un petit trou, nous amènons d'autres de bonjour, Cécile, nous adresse bonne situation qui où vous pouvez faire face avec. Docteur, merci beaucoup. You
Merci,
understand?
madame.
Merci beaucoup.
Yes. Thanks a lot.
Thanks a lot. It was an absolute pleasure.
Same here, ma'am. Thank you very much for having me.
And do have a bon voyage tonight.
Thank you.
Thank you. Et Cécile, ça c'est aussi notre topic conversation.
Today I would like to talk about a common topic, very common topic. Most of us have somebody in our families, near and dear ones, who have been suffering from a knee arthritis. The knee joint and the cartilage gets used up. They are not able to walk much. Especially when you see these old people, when it's a time in life to enjoy. That's the time when they spend in pain, not able to walk. Even inside the house, they feel embarrassed to walk in pain with a lot of limp and deformity. So what happens is, as we age, it's a general process wherein when the age catches up, some people lose hair, some people have grey hair, some people have white hair. Similarly, the cartilages of the joints, they also become arthrosed or used up. When they are arthrosed, the cartilage, which is a knee joint, is made up of 3 joints. the lateral, the medial and the patellofemoral, the front joint. So normally when the joint starts getting damaged, by the time the patient reaches us into the clinics and the hospitals, they are usually in a grade 3 or a grade 4 arthritis wherein the deformity has set in, and that's a stage wherein in most cases a surgical correction of the deformity, wherein the bow legs or the outward legs have to be corrected, straightened out and surgery done. So there's a lot of fear amongst the public, amongst the general population regarding the results of knee replacement. Well, with the advent of newer techniques, computer navigation assisted surgeries that we are delivering at Nivaran Hospital, we're very happy to announce that in this period we did about 4 knee replacement surgeries, and with the God's grace and the patient's will, all patients walked within 24 hours post surgery. So very happy to see the final outcome in terms of their satisfaction, their pain relief, their complete limp gone, walking straight without a problem, and the patient, once they are operated, they get a self-confidence in living the rest of their life normally. So if there's any query regarding your joints, your problems, or you have any questions regarding how it is done, how you can meet us, the numbers are there. You can always come contact us. We'll be happy to help you and bring you back to normal life with the minimal of damages. Thank you.